Hi, my name is Dr. Nikolai Nunes, and I'm from the MBBS class of 2020. Today we're going to talk about teaching and learning, as well as what a typical day looks like in the clinical environment. So, coming from the pre-clin environment, you're accustomed to two major modalities: sitting in the classroom, either doing lectures or tutorials. But teaching and learning is very diverse, very multifaceted, and you get more of this in the clinical setting, where teaching and learning can be just about anything you make it, in terms of to help you be a better student and a better doctor. So in the clinical setting, you have lectures as before. You also have tutorials as you did in pre-clin, but you also have clinical teaching, which is more active, more involved. I personally find it more fun, and I think it's great that when you study at the end of the day, or whenever you do study, and then you can see what you've read or what you've learned in a real patient, I always find that sticks better, that it reinforces. So it's more of an active learning process as opposed to reading, which might be more passive. And so in the clinical setting, you usually have, between medical and surgical specialties, you generally have what's called rounds, which goes back to early 19th century, where the doctors would actually take the juniors around the ward, which would be actually shaped in a circle, and you'd walk right around it and see all the patients, and hence rounds. And so what you're doing at that point in time is that you are looking at the patients, examining the patients, and discussing the cases with them, ensuring that all management has been instituted, that would have been put into place the day before, instruction that have been given. The clinical environment is multidisciplinary and interprofessional, so you have your nurses, your physical therapists, your pharmacists, your nutritionists, and you actually can be doing rounds in an interprofessional team, and you can learn from all these people, in addition to your direct clinical supervisors, which tend to be your intern, your resident, your consultant. And so that is a bit of a major difference from pre-clin. And additionally, besides rounds, you have what's called clinic, and that's where you see patients on an outpatient basis, which is they come into the hospital or your health facility to see you and then they leave, versus rounds, which would be patients who are inpatients. They're on the service, and they're going to be there for days, weeks, sometimes months. And if you're in a surgical subspecialty or specialty, you have exposure to the operating room, the operating theater, where you also get to learn and get to train. Medicine is an apprenticeship. And so what's really important is that you go out there and you attend your clinical settings. And they do have ways of enforcing this, but as I said, this is actually the fun part of medical school. This is where it starts to come together. It is a responsibility, because it's no longer you just being with your books. It's about you having some level of responsibility with your patients. And so that is a bit of teaching and learning. And let's talk about your typical day. So if you're in a surgical specialty, your day tends to start a little earlier. Sometimes you go up about 7 o'clock. The juniors, which would be students and interns, and even sometimes the senior house officers, tend to pre-round on the patients before the consultant and the senior residents, who lead the rounds themselves, come. So you might end up doing 2 rounds, depending. Most students like to come only for consultant ward rounds. I say go to both rounds if you can. It's a good chance to learn. It's a good chance to do. Sometimes we would organize our own student rounds, and so we would round before the doctors came, and that would help us prepare, because in the clinical setting you do have some responsibilities, such as taking a history from the patient, presenting the history of the patient's history to the consultant, examining the patient, presenting the findings. And a good medical student, when assigned to a patient, will follow up the course of the patient, which is called SOAPing the patient, which means it's called SOAP, Subjective Objective Assessment and Plan, SOAP. And so what you're doing is you're asking the patient, subjective, so, and the S, how do they feel? Has anything changed between yesterday and today? Objective, you're examining the patient, and if you find anything that's changed, you make note of it. Assessment, you look at all the evidence you've got, subjective, objective, lab results, imaging, and you make an assessment for the patient at that point in time, and then you write a plan for what needs to be done for the day. And that's what a good medical student does. And that's really how you learn. And beyond that, you might have classes during the day when you're not on rounds or when you're not in the operating theater. And also, as in terms of the outpatient part of it, the clinic part of it, every firm that you're attached to, which is that team of doctors and you as a student attached to them, has a clinic day or days where they see the outpatients. And so you're asked again to take a history, to examine the patient and come up with diagnosis or differential diagnosis of possible things and come up with possible plans. As you know, your standard core medical rotations, which is internal medicine, surgery, pediatrics, obstetrics and gynecology, tends to be in your third, and obstetrics in your fourth year. And you repeat these 4 core rotations in your final year. And so the level of difficulty obviously goes up between your junior rotations, which is third, fourth, and final year, fifth year. In the third year and fourth year obstetrics, the emphasis is on learning how to take a good history and learning how to do a good physical exam. It's not so much about the findings that you get, it's more about you need to be able to be competent in doing this. In your final year, they've expected you to master how to take a history and how to examine a patient. And now you need to build on that by, these are the findings I have, how do I manage this patient? What's the treatment? So it's what they call a spiral curriculum, where we're building on your knowledge base. And so really a typical day, as I said, would involve getting in there 7 o'clock, 8 o'clock depending, doing rounds, after rounds going to class. When class is finished, that's your free time to go back onto the ward and take your histories, examine your patients, come up with your plans, and also apprenticeship, learn procedures, assist your senior doctors, your residents, your interns with procedures. I mean, you have procedure cards with basic procedures that you will do supervised and unsupervised, from putting in IV accesses to drawing bloods to helping with a specialty specific procedure under supervision. And then you might have another class in the evening. Sometimes you have another round in the evening. And some days you have clinic, so you may not go to rounds, you may go to clinic. And that's a typical day in the clinical environment. I want to leave you with 2 thoughts. Medicine is an apprenticeship. See one, do one, teach one. And also William Osler said, the person who studies medicine without books sets to see uncharted. The person who studies medicine without patients doesn't go to sea at all. So good luck.